The panel will discuss today the subject of feelings are not facts. In a sense, that is nonsense. Feelings are, of course, facts. Feelings can upset you to the point that you shake all over. They can inspire you to a point where you forget yourself. So feelings are, of course, facts. But for instance, when you state that you feel there is something pressing in the brain and it feels like a tumor, patients make such statements, although I don't know how a tumor feels. I have never known that a tumor feels at all, or that a person can feel a tumor. A person can only feel pressure. But patients are fond to say, I feel it. How can you then say it is not a fact? When I tell a patient, why, there is no tumor, then this is the common answer, but I feel it, doctor. And many people speak in this manner. They feel something, therefore it is there. That's, of course, blank nonsense. Feelings are very emphatic facts. This means they can shake you, they can inspire you, they can make your heart beat faster, they can have any kind of effect, and therefore they are facts. But in ordinary life, when we speak of facts, we mean something else, nothing of the kind that feelings tell you about. We say it is 10 o'clock, and we say it is a fact. Why is that a fact? The reason is that you then can say, look at the watch and you will find out. What we usually mean by fact is something that happens or something that exists that somebody else can verify, and he then can state, well, you are right, it is a fact. If you say this is a brown table, then anybody can find out whether it is brown or blue. And if he finds it's brown, then he says it's a fact that it is brown. Will you understand, therefore, that there are subjective facts that the subject feels, and objective facts that everybody who has eyes, ears, hands, and certain intelligence can verify. And so the title of that article should read, Feelings are subjective facts, but not objective facts. But that title will take up about 2 lines in the book, and we don't want that. Therefore, we merely let it read, Feelings are not facts. But you should supplement in your mind the adjective objective and say feelings are not objective facts. But patients come along and tell me, I eat, I drink, I take a tablespoon of food in my mouth and it doesn't go down, it gets stuck in the esophagus. It gets stuck. Some patients go farther and say it gets stuck behind the tube, not in the tube. And you can't say that such a thing is a fact. So I tell the patient, that's impossible. No food can ever get behind the tube. It could possibly get stuck within the tube. Then some patients say again, but doctor, I feel it. And they mean, well, that proves it, if they feel it. Patients come to me and tell me they feel that something jumps in the chest. They feel that the heart expands. And then again I have the greatest trouble making clear to these patients that these are merely subjective feelings and not objective facts. Then these patients again come along with the statement, but doctor, I feel it. Again implying that feeling, subjective feeling, enables them to find an objective fact. Now the implication, I hope you will understand, the implication that this has for patients. If a patient says that his feelings, his subjective feelings, are equivalent to objective facts, then he can make a diagnosis. And he can then act on his own diagnosis. And according to his own diagnosis, his heart expands because he feels it. And you know, if somebody should actually be afflicted with an expanding heart, well, that's an extremely serious, fatal condition. That patient really passes the verdict of death and destruction on him. And if he is to avoid that course, then he must learn the difference between feelings and facts. This means between subjective feelings and objective facts. A diagnosis must naturally not be based on feelings. It must be based on objective facts that can be diagnosed, for instance, by tests, by examinations, by x-rays, by all kinds of evidence that only the physician can supply, and which the physician only can interpret. Only the physician knows what can be seen in an x-ray or in a test tube. But my patients trust their feelings. And then once they begin to go on the evidence of feelings, then I try to explain to them again what feelings are. The kind of feelings they speak of, I know, of course, what the common feelings are. I know what is love, hatred, fear. But look here, somebody says he loves somebody else. Then I'll ask him or her, what do you love in him? Then they become flustered. They don't know what the question means. I merely want to tell you these few remarks that I am going to make about love. I merely want to tell you that even in such a simple matter as love, people are not competent to state what it is. If a mother tells me she loves her daughter, well, I have no doubt that she loves the daughter. Should I, however, ask her what attracts you to your daughter, that wouldn't be a silly question, not at all. The attraction could be very varied. A mother may love the daughter just because she's a mother and she loves the daughter, I grant you, and that doesn't need any explanation. But if I ask the question, what attracts you to your daughter, that may be something else than love. A mother may be attracted to the daughter, for instance, by the desire to take care of her, to guide her. But then, if the daughter is already 18 or 20 or 25 years of age, and the mother wants still to take care of her, although the daughter is married and has perhaps children, then I'll ask the mother again, what attracts you to your daughter? And if she's again flustered by this question, I'll tell her what attracts her to her. It is the desire to possess the daughter, not to give up the possession of her daughter. And that's what we call possessiveness. There is nobody else perhaps in this world that will want to be possessed by this mother, that will tolerate her possessing her. And what we call possessive mothers are certainly mothers that love their children. They would want to take care of their daughter, not of strangers. But along with this love goes this desire to possess the body and the soul and every act and every decision of that daughter. And I have seen mothers who don't let their daughters even boil 2 eggs. They immediately rush up and say, let me do it. And you can't tell me that this is love. And if a father loves his children and constantly teases them so that they really become distracted, or he constantly says no when they ask for something, don't tell me that is love. That father may still love the children, but his love is outstripped by something that we call domination. He has no respect for the desires of the children. The children have no desire to constantly being teased. They have certainly no desire to be constantly treated with negativism. And in conclusion, let me sum up. Even such familiar feelings as love are of such a complex structure that your judgment about them is not competent. Anybody who has studied this subject of marital love and has studied it critically, he can perhaps give you an opinion of whether this love in a certain condition is genuine or intermingled with all kinds of other factors, and therefore not genuine, not even approaching the state of purity and singleness. And if that is true, you can now draw the conclusion that whenever you feel something in your body and then you make a pronouncement, you know what it is. You know that it is a swollen gland that you feel somewhere within the body. You know that the food doesn't pass through the esophagus. You know that the pressure in the brain, this means in your skull, is due to a high blood pressure, and you feel now the blood pressure has risen right now, mind you. Whenever you have the intention to make a statement, my advice is start it first as a diagnosis, and second as the result of a feeling, and feelings of the kind that I mentioned should never be trusted as revealing and representing facts. Thank you.